Welcome to the final session of the day. I hope you've enjoyed the day as much as I did. I've been really struck by the diversity of discussions I've had, the emphasis on co-production, on open learning and sharing with each other, and the kind of richness and depth of the content there's been. Obviously, the value of these days is properly measured, not just by the fun and the learning that we have now, but what we go on and do with it. I'm hoping that on the way home, you'll take a look at the live blog. You'll think about passing on things that will be of value to others. And at the end, you'll find an electronic pledge button. So give a little bit of thought to what you might do differently as part of today. Let us know, and we'll email you back in a couple of weeks to remind you. But now on to a real highlight of the day, announcing the Q Exchange winners. I'm going to take just a couple of minutes to set the scene and to celebrate the brain power and passion that hundreds of people have put into this process to get us to today. Then I'll be handing over to Jennifer, Chief Exec of the Health Foundation, to announce the winners in the Outpatients category, and then over to Hugh, the National Director of Improvement at NHS Improvement and NHS England, who'll do the same for the Building Improvement Capability category. So we started today talking about how Q enables a more collaborative approach to learning and improvement, making it easier to bring together all of the perspectives and skills needed and align action at all levels in the system, and scale what works in a dynamic and organic way. And Q Exchange is a really great example of this. Just to start with pooling expertise, I think it's worth reflecting that the projects that were voted on as part of Q Exchange have been through a process that's really unlike any other grant programme I know of. There have been community members and others feeding in suggestions and ideas and connections to help ideas develop and grow. The 1,237 comments that have been posted so far online, I think, gives an indication of the appetite for that way of working. And I want to thank you for the part that you played. There are projects here today from the first round of Q Exchange that show a little bit of the creativity that this unleashes. From amplifying experience stories to working in partnership with patients to Hexatime, making it easier to exchange skills on a voluntary basis. I think you've taken the idea of pooling perspectives and you've run with it. Another of the 2018 winners here today nicely shows what's possible when we combine action at multiple levels. So making data count, it's a set of resources on statistical process control that was developed and built centrally. Boosted by Q Exchange, a real kind of movement has gathered around this. Over 1,000 people have been trained, both 80 trust boards and then hundreds of people at the front line within those organisations. And then finally, Q Exchange itself, I think, is a great example of a sort of new iterative approach to building and scaling change projects. Our hope is that all of the project ideas that community members shared through this process will have gained some kind of input that helps them on the way. And those that made the shortlist will have attracted supporters that will stick with them, that will be there to offer advice and support when they stumble and to help them spread when the time comes. So as you listen to the results, think about which projects you'd like to stay close to or to help boost over the year ahead. And as we get into the day now where we celebrate the winners, let's remember that everyone who's participated in this process has real reason to be proud for setting the bar so high and for the spirit in which they've engaged in it. The capacity of Q Exchange to activate ideas with potential relies on the participation of a lot of people. That is one of my key messages. We're talking about the 750 members and non-members who took the brave step of collaborating to put forward 180 initial ideas. Then those who helped prune, splice, nurture those ideas as they grew. Then we've got the 38 people who took part in panels tasked with shortlisting 117 full proposals down to 30 for the community to vote on. And then we've got the 608 people in the community who took the time to read 30 project proposals and pick their top 6. And that means that the winning 20 reflects the wisdom of this very wise crowd. So I'm going to hand over to Jennifer now, who'll say a little bit about why understanding alternatives to outpatients is an important topic for us to be tackling together, and then she'll be announcing the 8 winners in this category.
Thanks so much, Penny. I have to say, the first thing I've got to say this afternoon is a very, very big thank you to you all, because this afternoon I've really been cheered up. Some of you know that the Health Foundation does a very wide variety of things, and one of the things we do is we track the election and do policy analysis. And I've spent the last 2 weeks steeped in this stuff, and let me tell you, I've been so gloomy and down, and this is the first high spot of my last 2 weeks, so thank you so much. So I am going to propose a new Q SIG group, which is the Q on Marsh, because I reckon if the Q community was a party, it took over the country, you do a better job, wouldn't you? Yes. Okay. The second thing I just wanted to say, and I think most of you know this, but I also wanted to underline that the Q is just such a very exciting, interesting way of trying to make progress, isn't it? And I think all of you here probably have testimony for that. But I'm really thrilled that our board have also agreed that, and I think you may know from Penny, from earlier communications, that we are going to be funding Q for 10 years, and that's in the first instance, because we think this is a long-term asset, isn't it, for the National Health Service and beyond. So really thrilled about that, and very thrilled to have partners with NHS and I on our journey as well. So I'm supposed to get down to business, aren't I? Outpatients, clearly very important, very iconic challenge, central to the National Health Service, central to patients' lives. 30% reduction needed over 5 years, massive challenge. And what better challenge to put the Q collective energy to. Important not just for a whole variety of reasons, but when I see it at a personal level, my parents are in their late 80s, and life for them now is an endless round of NHS appointments. Travelling, my dad's just lost his sight practically, so he can't use the car, so he now has to catch the bus or an Uber to the local hospital, which is now far away because hospitals have been rationalised and consolidated. So it's a big, big issue for them, and their last years are being spent. And that's just one set of group of people that I think. So very, very iconic. John Dean told us this afternoon that outpatients started in Paris in the 18th century, and it hasn't changed much since, which I didn't know. However, I do notice, because of the policy analytic hat, that it hasn't changed that much. However, did you know that the number of outpatients has doubled in the National Health Service over the last decade? And it's now touching 120 million a year. So whatever's happened, however difficult change it is to make, doubling over that length of time, any major industry would find that to be absolutely critically important, wouldn't it? So well done to everybody who's managed to achieve that. But as we know, we can't just keep turning up the tread machine faster. We've got to do something about it. So very exciting to know that this then is the major theme of the Q Exchange. Very, very happy to announce the 8. I better not say winners, had I? What's the collective word for winner? But those who have got through to the next phase, let's put it that way. Because delivery is all. Being selected is one thing, being delivered. So the first one I'd like to announce now is that we have redesigning outpatients through inclusive participatory co-design, working with local people to reimagine. And of course, co-design is a big, big issue. Very, very good to see emphasis on tailoring, designing tailored models to meet the needs of those who want a higher or lower tech experience. So that's the first. And am I allowed to say who these people are? Yes, clap. Okay, that's number 1. Number 2 is co-producing solutions to the outpatient challenge with patients. Those of you who are in the audience, please sort of say yeah if it's you. But very interesting to see the use of behavioural insights. And I know behavioural insights has attracted a lot of attention from the Q community, quite rightly. So there we are, BI. Yeah. Third, the rather intriguingly named the virtual hug of support, supporting self-care by testing different ways to... Yeah, there you go. And I understand part of the virtual hug is testing animations and other formats in one place that can be shared through Q. So congratulations, look forward to seeing those animations. Next, supporting colorectal cancer patient self-management, testing an app that helps patients track and understand their care. Again, an example of a project, interestingly, using behavioural insights and AI, artificial intelligence. and to help make the most of data-driven technology. So wonderful there. Next, virtual blood clinics, enabling remote access to tests. That would be great for my parents. And communication with specialists for those with blood disorders. And again, supports the wider LTP goal of reducing outpatient appointments by a third. Reducing unnecessary outpatient, yay! Outpatient appointments in kidney care, software platform to redesign and follow up care. Again, using technology to support the shift, with a lot more done virtually, which has got to be the future, hasn't it? So there we are. And the Outpatients Innovation Collaborative. Yeah. Interesting to see how the technology and innovation world coming together with process improvement technology in this particular one. We thought that was a good example. Is that me, or is that the next one? No, this is the last one, sorry. Delivering community pediatrics for Roma Slovak patients in Sheffield. So really interesting with a particular group and how to address inequalities in health in one of the more vulnerable groups. So that was a winner. So very thrilling. I'm sure you'll make the 30K go very far, and look forward to hearing about it in future Q meetings. Thank you.
And thank you to you for celebrating concisely so that we can make sure people feel properly appreciated, and then we can move on to the drinks reception. Anyway, let's move straight now onto the second topic, building improvement capability across boundaries. So this is deliberately a broader topic, which means we've got more applications, and it means we've got 12 teams to announce in this category. I'll hand over to Hugh to say more.
Thank you, Penny. Good afternoon. I'm absolutely delighted to be here. Today sort of combines two things that are really important to me. The first, my previous job, which I left about 7 months ago to take up the National Director of Improvement. I was Chief Executive of the South Eastern Trust in Northern Ireland, and they are represented here today. You can see Nicola and Claire's here and Ruth in the audience. So I'm absolutely delighted, though. I left 7 months ago, but the Trust is continuing to come to national stages. And I'll say a little bit later, but I left probably what I believe to be the best job in the world, because we spent 10 years embedding improvement into how the organisation was run. And so it became right into the organisation. It was how we did business. It was everywhere within the organisation. And so when you've spent 10 years building that, to leave it is actually quite difficult. So it's lovely to see them and some other colleagues from Northern Ireland here as well. But the other piece which has been really important to me was being part of an improvement community. For over the last decade, to be a part of that, to go to different events, to connect with people who have that same passion, who have that same interest, who actually believe that using improvement methodologies and empowering staff to use them and embedding improvement capability into the organisation is the future for the NHS. And that was my belief. And that's why I think the Q community is so important, because actually what you're a part of today is an improvement community, and it's a growing community. If we're actually going to deliver the change we want in the NHS, if we're going to deliver a new culture and a new approach, I would describe and have described this job, and it's the reason I took it up, which was to actually embed an improvement culture like I had and we did in the organisation I was in, right across the NHS. Imagine the inspiration you've had by being part of the Q community, the inspiration and motivation that you've had to be able to do improvement work. Now imagine if we spread that right across the NHS. Imagine if the hundreds of thousands of staff, many of whom feel quite disempowered, who feel that they're just running faster and harder on a hamster wheel. Imagine if we give them the skills and create the culture where they can do improvement and be part of this community. So that's why I think the Q community is actually creating that. It's helping to build that early stage of creating a community right across the NHS. If I have one final piece of advice, because I'm going to jump into the awards next, and congratulations to, I think, all 180, because you've been involved in projects which were worthy enough to be submitted, to be entered, to the 30 that have been shortlisted. And in many ways, the recognition is really important, to know that that project is worthy and it's getting seen on a national stage. But if I was to give you one piece of advice, the real prize is the connections you make. The real prize is that you actually can connect with others who've done other pieces of work that could be really useful to you, could be really useful to your patients, could be really useful to staff that you work with. And in a sense, I think we've over the last decade lost some of a behavior where we used to share a lot, where we used to spread things that worked, and we used to actually look to take things from others that worked. And actually, those are the behaviors that we need to make sure that we rediscover. So I would almost, the real prize for you today is one of the other projects that you've seen. Take it back and make sure your patients and staff benefit from it. Build a connection with somebody else that's doing a piece of work in this area, because that's the real prize for your patients and for your staff and for the service that you work in. Okay, that's enough of the advertising. I'm going to do it slightly differently. I'm going to sort of do this sort of Oscars style, try and do a bit of tantalizing before I actually announce the next. So the first winner is a project that would probably say that improvement is 20% technical and 80% human. So these two believe it's them, okay? So we'll just see. We'll just see if it is. Psychology for improvement. Well done. Now, everybody else is going to remain straight-faced in case I pick them out. The second award winner is a great example of building capability beyond healthcare professionals in the critical role of families and informal carers. Everybody's quiet, nobody wants to acknowledge. And it is the supporting parents to care with children with medical complexity. The third award goes to a lot of the improvement. We've seen a lot of the quality improvement has been very much hospital focused, but this is from another sector. Which could it be? Ambulance queue. I'm shortening the evening here. The fourth one is about how do we actually, it's the use of developing coaching in QI. So again, somebody's hoping that must be us, that must be us. The Quality Coach Development Program. The fifth one is a UK-wide one. So this is the Celts are, and I think this is our one chance. This is it. And it's about see how communities of practice emerging as a popular model for connecting and building capability within Q. And it, of course, is the community of practice, human factors, and quality improvement. The next one is very much around how do we actually use and share evidence. And it's an ambitious project which makes it easier to find and share things that work on an evidence base. Evidence-based QI, putting our heads together. And the next one, I just have to make clear that I had no part in the voting. So when I said that the last one was, or a couple ago, was a sort of the Scottish influence, well, we also have now one from Northern Ireland, Gamification for Human Factors. And the three from my trust are going, why? We thought it was us. The next one is a is a primary care project. And I think this is really important because it actually really reinforces one of the things which is important, that is this QQ community can reach in to primary care. One of the things I see as a key part of my new role is we will be developing an improvement framework, which is going to be like a map or a navigation system for every level of the NHS to embed improvement and embed an improvement culture. And critical to the future is that we do that across primary care and across systems. So I'm really pleased to see this one, using QI to tackle health inequalities in primary care networks. The next one is an interesting example of crossing disciplines, and it brings together discipline from outside healthcare along with healthcare improvement, and it is from engineering. So it's improving improvement. The next one proves that Q members voted for, I think, for projects which might not be seen as mainstream. They might be seen as quite niche, but I think it's a big reflection in terms of the Q community who looked at these projects around, are they really worthwhile? So it's in an area which might not be seen as mainstream, prison healthcare. And this one, I really have to say, I had no input to the judging because it is my own former organisation, QI training and project support for trust support services. And Nicola is there if anybody wants to take that one. She'll organise visits. She kills me whenever I was there because I used to say, Nicola, I'll host a visit. So we used to get all these things. So Nicola's sitting over there if you want to go and see that one. And finally, the last one, last but not least, and it's good to see, again, I talked about primary care, but it's also great to see an ICS-based project. And the final one is Improvers Without Borders. So congratulations to all those 12 award winners. But as I say to you, all 30 and indeed all 180 are really worthwhile projects. Don't leave without making a connection. I know that's part of the culture and part of the ethos of the Q community. But make sure you take some of the other ideas back, because that will be a real benefit for your services and your patients. But well done. Thank you.
Thank you, Hugh, and let me add my congratulations to all of the teams and all of the people who put forward ideas. And on the assumption that you haven't had enough...
I'd also like to thank the Health Foundation for finding this guy who actually looks like a little bit like me 15 years ago. So I'm not sure where they got the photograph or where he got the hair, but it's...
That's what moving to England looks like. So, assuming you... That's not what you said. Future funding for Q is still conditional on NHS England. Assuming you haven't yet had enough of either Q or Hugh, I just want to give a quick plug to this webinar, which will be for Q members coming up in December, a really good opportunity to hear more about what Hugh has planned and to have an opportunity to shape that. Now, in a moment, I'm going to be moving into a reception so that we can all celebrate with the teams who won and show our genuine support and respect for everyone who put forward ideas and made Q Exchange what it is. But I want to end by quickly going back to the party theme that we had at the start of the day. Like all good parties, there's been a lot of hard work behind the scenes which the organising team keep gracefully hidden from view. I'd like to thank in particular Katie and the team behind this event and Q Exchange in the Q team. I'd like to thank the venue and our event support company, the 45 speakers and the groups that convened meetups during the day, the session designers and the Q member volunteers who helped develop the programme and have helped in many ways since. Thank you. parties, they are ultimately made also by the crowd that they attract. So whether you've been joining us in person or virtually, thank you for making it a great day. Let's say farewell now to the people on the live stream and move into the gallery for the reception. Bye.